Tonight, advocates are speaking out about a new federal law that could have serious consequences for people with disabilities in central Georgia.
Last week, President Trump signed his budget bill into law. Some local advocates say some of the bill's components could put lives at risk. Jasmine Lee's in studio to explain how the law could affect Georgians who rely on Medicaid.
That's right. I spoke with Armando Villas, an advocate with the Houston County Democratic Committee's Disability Caucus. Armando was born blind and knows firsthand how crucial Medicaid is, not just for himself, but for many people with disabilities. For Armando Villas, navigating the world takes more than just a cane. He was born blind and depends on Medicaid to cover his doctor visits and transportation.
I was very angry when it passed the House and headed toward the president's desk.
The new bill could slash Medicaid funding for in-home care, transportation, and basic medical services he relies on. Without that support, he says some people could be forced into nursing facilities, not because they need full-time care, but because they'd lose the help that keeps them independent.
I actually went to Washington, D.C. earlier this year to advocate against this bill. We started with our Senator Warnock.
He also warns many people could face higher medical costs, have fewer options, and travel further to get basic care. The law does require states that previously expanded Medicaid to charge enrollees for some services if they make a certain amount of money.
I'll have to pay out of pocket almost every single time, meaning that I can end up going into debt.
And he's not alone in his concerns. Heaven Smith, a mom to 3 autistic kids, worries about what comes next.
We already struggle as it is. Why would you want to make us struggle more?
Medicaid supports her kids' therapy sessions and essential supplies needed daily, like diapers. And if SNAP work requirements or benefit cuts go into effect, she fears missing out on the help that feeds her family.
ABA was cut from our family's lives. We would be in turmoil. We struggle even more. ABA has made my kids help them so much.
She worries the impact will go far beyond her own home, hitting neighbors, hospitals, and families just trying to get by.
Everybody is going to be affected by this bill, and it brings lots of uncertainty in our lives.
Right now, Villas and other advocates are urging Georgia leaders to protect local services and help people adapt to the new law. Back to you.
Thanks, Jasmine. The first round of Medicaid cuts in the bill won't take effect until October of 2026. The rest will be phased in over the following 3 years.
If Medicaid enrollees do have to pay more out of pocket, the bill says that won't apply to primary care, mental health care, or substance abuse treatment.
The budget bill does include a work requirement, meaning many people will have to work to stay on Medicaid. That requirement will take effect in 2027. Now, Georgia already has a work requirement in place under the state's Pathways program. That took effect when Medicaid was partially expanded in 2023, but that was not under the Affordable Care Act. Eligibility for the Pathways program is limited to people earning 100% of the federal poverty level. The state also conducted a redetermination process in 2024 to figure out who still needed that coverage after the pandemic.